Going to talk about antibiotics. This topic surely will be helpful for you and other medical personnel who are in practical usage of antibiotics in patients. So let us talk about the antibiotics. Antibiotics are also called the antimicrobial agents. The antibiotic is a word, the combination of two words. One is the anti, means against, and bios means life. So these are the agents which are active against the biological agents, the microorganisms, especially the bacteria and parasites. The drugs which are against the viruses, they are not included, they are not said to be the antibiotic. So the antibiotic is an antimicrobial agent that kills or inhibits the growth of bacterium or parasite. So the viruses, the antiviral drugs are excluded. They are not antibiotics. Antibiotic may be bacteriostatic, bactericidal, narrow spectrum, broad spectrum. So the antibiotic is grouped as a bacteriostatic or bactericidal, or it may be the narrow spectrum antibiotic, or it is said to be the broad spectrum. Coming to the action of antibiotics, how the antibiotics act on the microorganisms or the bacteria or parasites. The antibiotics, they do not act on the host cells such as the human cells. These are only active against the microorganisms. Nevertheless, we take the antibiotics. These antibiotics are not active against our cells. They are active against the microorganisms because of some differences in the human being cells and the microbes. So antibiotics have the different mode of action. Some antibiotics, they inhibit the cell wall synthesis, and the other antibiotics, they inhibit the protein synthesis. And third way of the mode of infection of the antibiotics is the inhibition of the nucleic acid synthesis. And the fourth one, alteration in cell membrane. So the four important methods of acting of antibiotics. Antibiotics may act by these four methods. The cell wall synthesis, they are the inhibitor of cell wall synthesis. They inhibit the protein synthesis. They inhibit the nucleic acid synthesis, and these are the penicillins, cephalosporins, and starting from the penicillins. Penicillins, they are classified into two big vast groups, the penicillinase susceptible and the penicillinase resistant. What is the penicillinase? Penicillinase is an enzyme which is produced by the bacteria, and this is also called the beta-lactamase. The other name of penicillinase enzyme is the beta-lactamase. So those penicillins which are susceptible to the beta-lactamase, they are called the penicillinase susceptible. And those which are resistant to the penicillinase, they are penicillinase resistance. Let us to describe the penicillinase susceptible antibiotics, and these antibiotics are the ampicillin, amoxicillin, piperacillin, penicillin V, penicillin G, and ticarcillin. So these are the penicillins which are beta-lactamase susceptible. Means those bacteria which produce the beta-lactamase or the penicillinase enzyme, they are degraded by the bacteria. So these are says these antibiotics are said to be susceptible, penicillinase susceptible. And those which are the penicillinase resistant, for to remember, is the MNO. M for the methicillin, N for the nephacillin, O for the oxacillin. So these antibiotics, these am- these penicillins are penicillinase resistant. Means they are not degraded by the bacterial enzyme, that is the penicillinase. So these are much more useful than the penicillinase sensitive. Now, what are the beta lactamase inhibitors? Beta lactamase, as you know, the beta lactamase is an enzyme produced by the bacteria, and the in this way this enzyme makes the penicillin inactive. So what happens? We use the beta lactamase inhibitor. We combine the beta lactamase inhibitor with the penicillins in such a way that these penicillins are active against the bacteria. So we combine the beta lactamase inhibitor with the penicillins, and it becomes the resistant. It becomes this antibiotic becomes resistant to the penicillinase, to the beta lactamase. And which are the drugs which have the beta lactamase inhibitor, and which are the beta lactamase inhibitors? These are the which I have highlighted. The clavulanic acid is a beta lactamase inhibitor. This is combined with the amoxicillin, and you will be well aware of the drug. आपने नाम सुना होगा बेटे, आगमेंटिन. आगमेंटिन सिरप फॉर्म में भी आता है, और इंजेक्शन फॉर्म में भी आता है, कैप्सूल फॉर्म में भी आता है, टेबलेट फॉर्म में. तो augmentin is a well known drug in the market, and this is combination of beta lactamase inhibitor and plus amoxicillin. So you should remember that what contains the augmentin. What is the composition of the augmentin drug? It is a combination of amoxicillin plus the beta lactamase inhibitor. In such a way, another drug, the other penicillin, the penicillin, which is combined with the beta lactamase inhibitor, is the timantin. So these are the market names. These are the augmentin, clementin, timantin. These are in the brackets or the market names of the drugs. Another beta lactamase inhibitor is the sulbactin, that is also combined with the amoxicillin with the trade name of the sulbamox. So these my purpose to describe the beta lactamase inhibitors is that these inhibitors are combined with the penicillins, so they become much more resistant to the bacterial beta lactamase. This was the slide which I should have kept on the before the penicillin, but however, anyway. So inhibitor of cell wall synthesis were these, which I have told you: the penicillins, cephalosporins, carbapenems, monobactams, and vancomycin. And how the cell wall synthesis is inhibited, how the cell wall synthesis is inhibited, there occurs the inhibition of the transpeptidation. Transpeptidase is an enzyme which causes the synthesis of the cell wall of the bacteria. So these penicillins inhibit the transpeptidation, means they inhibits the formation of the peptidoglycan layer of the bacteria. So the penicillins, cephalosporins, carbapenems, and the monobactams, vancomycin, these are the inhibitor of cell wall. We have described the penicillins. Let us come to describe the cephalosporins. Cephalosporins. Again, the cephalosporins, they are also they contain the beta lactam ring. Coming to the back, these cephalosporins, carbapenems, and monobactam, these contains the beta lactam ring in their structure. So these are called the beta lactam drugs. The cephalosporins, carbapenems, monobactam, these contain the beta lactam ring in the structure, so they are called the beta lactam drugs. Now, the classification of the cephalosporins, these are the G for the generation. The first generation cephalosporins are these, and आप लोग तो इस ड्रग से वाकुफ होंगे. The Ceporex and the Velosafe, Durisafe, these are the trade names. ये आप you might have been come across in these drugs. So the Cephalaxin, Ceporex, Cefaradine, जो Velosafe के नाम से, Cefadraxil, Durisafe के नाम से. So generation, the first generation are these three drugs, and the second generation, these are the cefaclor, cefuroxime, and the third generation. So these are the different generations of the cephalosporins. The first, there was a generation one, and then uh, they become available the generation two in the market, and afterwards the generation three came to the market. And generation 3, the important drug is the cefizim, which is the oral drug, and this is available in the market as a cefspon, the cefim, or the cefigate, the very active oral drug against the many bacteria, and especially also active against the typhoid fever, the cefizim. You you should remember the cefizim with the names of the cefspon, cefim, cefigate. And other drugs are the cefotaxime, ceftriaxone, ceftazidime. These are the different uh, cephalosporins in the third generation. Now the fourth generation has been also introduced, and the fourth generation contains these four drugs, and the important one, which is which is available in the market, is the cefodoxime. This is the oral drug used for the tonsillitis. The important drug used in the tonsillitis and pharyngitis, the Orilox or the Prelox. So these are the generations of the cephalosporins, and the second and the third one group, which are the group of drugs, antibiotics, which inhibit the cell wall synthesis, is the carbapenems. Carbapenems, they are also the important drugs which are used. They are very expensive and they are used in the typhoid fever, the multi-drug resistant typhoid fever. Nowadays, the typhoid fever, or which is also called the enteric fever, is becoming day by day resistant to the antibiotics. So the last resort of eradicating, resort of treatment is the carbapenems. ये बहुत these drugs are very expensive. जब ड्रग रेजिस्टेंट हो, मल्टीपल ड्रग, टाइफाइड जब रेजिस्टेंट हो, तो फिर आखिर में जो है हम कोशिश करते हैं कि ये एंटीबायोटिक दें. और then the salmonella typhi, which causes the enteric fever or the typhoid fever, is then treated properly. However, these drugs are very expensive, very expensive. The fourth group of antibiotics, which are which act on the cell wall synthesis, which inhibit the cell wall synthesis, are the monobacterials. Going to forward, now coming to the second mode of action of the antibiotics is the inhibition of protein synthesis. First was the inhibition of the cell wall synthesis, and the second mode of action of the antibiotics is the inhibition of protein synthesis. And the protein synthesis, they these drugs act on the 30S, the ribosome messenger ribosomal 30S, or they act on the 50S, the subunit of the ribosomes. In this way, the protein synthesis is inhibited, because the messenger RNA is the function of the messenger RNA is to synthesize the proteins, and the messenger RNA has two subunits. One is the 30S and the 50S. In case of the human beings, in case of the bacteria, there is the ribosomal molecular weight is the 70S, and these are the subunits of the 70S, 30S, and 50S. While in case of the human being, the messenger RNA is the 80S. So the those antibiotics which are against the bacteria, they act on 30S, 50S, and 30S and 50S, they are absent in the human beings, because the composition of the messenger RNA is different, is the subunits are different. So those which act on the 30S of the bacteria, these drugs, these antibiotics are the aminoglycosides, well-known drugs. And the second group is the tetracycline. So the tetracycline aminoglycosides, they act on the 30S subunit, and those which act on the 50S of the messenger RNA are the chloramphenicol and the macrolides and the clindamycin. So these are the drugs which inhibit the protein synthesis by acting on the messenger RNA subunits, and these there are the two subunits 30S and 50S. Now the aminoglycosides. Here the drugs which act on the 30S were the aminoglycosides. So coming to the aminoglycosides, these are the aminoglycoside drugs, very effective in the gram negative bacteria, in the gram negative bacilli, which cause the urinary tract infection. You will be well aware of the E. coli, Enterobacter, and Klebsiella. E. coli is the most common bacilli, gram-negative bacilli, which causes the urinary tract of the human beings, UTI, which is known as the UTI, urinary tract infection. And these aminoglycosides are very effective against the urinary tract infection. And well-known drugs, well-known aminoglycosides are the gentamicin, amikacin, tobramycin, and the spectromycin and kanamycin, neomycin. So these are the aminoglycosides mostly used in the urinary tract infection, and they may also be used locally. So the aminoglycosides may be systemic or the local. The next one, the antibiotics which inhibit the protein synthesis. So the macrolides or the antibiotics which act on the 50S. So describing the macrolides, classifying the macrolides, which are the macrolides. These are the macrolides. Erythromycin, very common drug in usage, in the community usage, is the erythromycin, used mainly for the upper respiratory tract infections such as the tonsillitis and the pharyngitis. The erythromycin is in common usage. However, the dosage is quite difficult to use, uh, 4 times a day, so it is difficult to for the compliance of the patients. 4 times a day drug is taken, so quite difficult to take the drug orally. However, the roxithromycin is very easy to take, and this is known as with the name of trade name of the Rulit. So the very important drug roxithromycin is given twice a day, so it has the advantage over the erythromycin. This was the 4 times a day, and this is the twice a day. And then comes the clarithromycin, very important drug for the tonsillitis and the pharyngitis. Clarithromycin with the name of the claricid or the nuclear, and this is effective for the tonsillitis, and it is also given in the H. pylori infection, the Helicobacter pylori infection, which causes the chronic gastritis, all the peptic ulcers. So this drug is also effective in the H. pylori infection, Helicobacter pylori infection. Another, the macrolide drug, which is recently has been introduced and is a very effective, and the advantage of this azithromycin is to take once a day. Once a day. This was a twice a day. This was a twice a day, but the azithromycin is given as uh, as a single dose once a day for the maximum of the 5 or 7 days for the tonsillitis, and also use for the resistant, the and the resistant enteric fever, typhoid fever. So the azithromycin is given in the enteric fever, which is resistant, multi-drug resistant, and the fourth one is the telithromycin. So these are the macrolides. Now the third mode of action of the antibiotics is the inhibition of nucleic acid synthesis. The antibiotics which inhibit the nucleic acid synthesis of the bacteria. These are grouped in three ways. Those which cause the inhibition of the precursor synthesis, this includes the sulfonamides and the trimethoprim, and those which inhibit the DNA synthesis, these are the fluoroquinolones, and third one is the inhibition of messenger synthesis. So these are the nucleic acid synthesis inhibitors, and the important one, these are they are grouped in a three. However, the important one is the fluoroquinolones, which inhibit the DNA synthesis. So coming to the fluoroquinolones, you might be aware of you should be aware of the fluoroquinolones. They are also known as the quinolones, and again the quinolone drugs very effective for the bacterial infections, and they are divided into different generations. Likewise, the cephalosporins, the quinolones also has the different generations. So the first generation drug were the pipidemic acid, uraxin, still is given in the urinary tract infection, and these are the first generation drugs. Nalidixic acid with the name of the nalacid or negrom, and the norfloxacin, noroxin. So these are the first generation quinolone drugs. Later on, the generation 2 was introduced, and the generation 2 drugs are the ciprofloxacin, very well known, very famous drug, ciprofloxacin, with the name of the marseparcicin or the ciproxin. So it is a very effective drug in the urinary tract infection and the typhoid fever. Is the ciprofloxacin or the ciproxin, marseparcicin are the trade names. Another drug is the ofloxacin, is still available in the markets with the name of Terivit. So generation 2 contains the ciprofloxacin, ofloxacin. Do you hear me, please? Hello, student.
Yes, sir.
Hello. Okay. The fourth way of action of the antibiotics is the alteration of the cell membrane. These drugs, these antibiotics change the cell membrane composition, or they alter the cell membrane. And these drugs are the may be divided into these three categories: the bacterial cell membrane, those which act on the bacterial cell membrane, known as the polymyxin. पॉलीमैक्स तो आपने सुना होगा, दी पॉलीफैक्स के नाम से आयंटमेंट आता है, पॉली फैक्स के नाम से आयंटमेंट भी आता है और लोकल जो है आयंटमेंट भी आता है जिसमें होता है पॉलीमिक्सिन भी होता है। तो फंगल सेल मेम्ब्रेन में जो ड्रग those drugs which antibiotics which alter the fungal cell membrane, they are the nystatin and terbinafine. Those children, the fungal infections are the oral infections are common in children as well as the immunocompromised patients. आपने सुना होगा कि मुंह पक जाता है बच्चों का, तो जो उसमें जो है हम एंटी फंगल ड्रग देते हैं। निस्टेटीन जो है ओरल ड्रॉप्स हैं वो माउथ में देते हैं जिसमें वाइट स्पॉट्स हो जाते हैं टंग में एंड बकल म्यूकोजा में, यूजुअली दी न्यूनेट्स या चिल्ड्रेन में ये फंगल इन्फेक्शन ओरल इन्फेक्शन होता है। लेकिन this one is not so effective nowadays. The other recent drugs has been introduced. The recent antifungal drugs has been introduced which act on the fungal cell membrane, such as the terbinafine, very active drug against the fungal infections. Either these are the nail infections or they are the skin infections and are the superficial uh, infections of the skin. So, so the terbinafine is a very effective drug. It is also available in the tablet form and the ointment or the cream form. The, the third drugs, antifungal drugs, which act on the cell membrane, they are the known as the azole derivatives. Very effective drugs, very effective antifungal drugs for the systemic use as well as the local use. And these are, sorry, fluconazole, ketoconazole, itraconazole, and also used in the fungal infections of the females, the vaginal candidiasis, and the other skin infections. So this is the summary of the those drugs which I have described. The one way of action of the antibiotics is the inhibition of the cell wall synthesis, and this is a cell wall of the bacteria. So those drugs which act on the cell wall, these are the penicillins, cephalosporins, carbapenems, and monobactams. These act on the cell wall. They enable the cell wall synthesis. Cell wall synthesis is very essential for the replication and for the survival of the bacteria. जब तक सेल वॉल नहीं बनेगी तो रिप्लिकेशन नहीं होगी, ग्रोथ नहीं होगी, and the bacteria cannot survive. So the mode of action of these drugs is to enable the cell wall synthesis. And the other mode of action is the nucleic acid synthesis inhibition. So the nucleic acid, this is a nucleic acid or the DNA. So the DNA inhibition is DNA is inhibited by these drugs which I have earlier mentioned, which are the DNA inhibitors, and and the other which inhibit the protein synthesis. I have described those which are act on the 50S and those which are act on the 30S. They inhibit the protein synthesis, and the fourth one is the inhibitors of the cell membrane. So these are the four groups of antibiotics: cell wall synthesis inhibitors, nucleic acids inhibitors, protein synthesis inhibitors, and cell membrane inhibitors are the which alter the cell membrane. This one is the tabular form of the antibiotics, the different classes of the antibiotics, the aminoglycosides, the carbapenems, and then the cephalosporins, the first generation, second, third, And the fourth one, the fluoroquinolones, another group, important group, and this encompasses the different antibiotics. The penicillins group, either they are sensitive or they are the resistant. So this is a summary of the whole antibiotics, which act by different ways, by different mode of actions. I hope you will be aware of these now. I have elaborated these drugs, and please, if you like this PPT to be useful for you, please don't forget to subscribe and to view them. Thank you very much. Thanks.